So our purpose today, if you read in your program, we're in an era of data-driven healthcare. We've talked a lot today about the demand of consumers to have access to their health information, to do more, to be empowered, to use that health information themselves under their own control and steam. So with me, I've got, we thought we were going to have two, and in fact we have three wonderful forward-thinking privacy experts from across the country. So on my left, I've got Michael McAvoy, the Commissioner from British Columbia. And in the middle, I've got Pamela Snively, who is the Chief Data and Trust Officer for TELUS Health. TELUS, excuse me. I could have stopped the sentence, including TELUS Health. And on the right, my right, your right, I've got Commissioner Michael Harvey from Newfoundland and Labrador. So we've got a great panel, and I should make a couple notes before we start off. Michael has been valiantly trying to get from Newfoundland and Labrador to Toronto, to Ottawa, excuse me, don't even know where I am. Ottawa for what, a day and a half now?
Yeah, so I just want to say, I moved home to Newfoundland from Toronto 15 years ago. I lived in Toronto during the famous event when Mel Lastman called in the tanks because of the snow. And I've spent 15 years explaining to people in Newfoundland that there was issues, there were valid issues, there's snow on the tracks and so on, and the people in the streets, and there were reasons he had to call in. I rescinded all of that apologizing in Toronto's behalf.
It's over?
It's over. Toronto's back in my bad books now after all of these cancellations over what looked to me to be about 5 centimeters of snow. So it's just the official word from the East Coast is, can't handle your snow, Toronto.
So I have two observations to make. One is that it's a good thing Michael does not travel the way I travel. You do not want to see me in a pair of Lululemons up here. So well done with your travel gear. I was excited to see, so we wondered if perhaps the audience would notice if we switched out one Commissioner Michael for another, and I still can't believe you said yes. Mic me up. I don't know what we're here to talk about, but let's go. So.
And this is equally, I should say, confusing now at our federal provincial meetings because we actually have Michaels from coast to coast.
Yes.
Michael East, Michael West.
That's it, and I should say 5 centimeters, if that happens in Victoria, BC, where I'm from, there's no planes moving anywhere. Like, at least I got here at 2 a.m. Today. It's like the whole place is shut down because we don't even have snowplows. It's quite a place to live. I won't trouble you with any more of that commentary about Victoria.
So that is my secret strategy. Get our commissioners very sleepy and put them on the hot seat. See how well this goes for me. So as you'll gather, we're intending to have an informal conversation. So I've got a couple questions that I've been dying to ask my colleagues along the panel. So I'll start off and get things going. But we're looking forward to having you folks head to the mics and drive this debate as well. So the first question we want to talk about here is, as I said, patients, and I should stop saying patients, citizens are looking for access to their information and more control over their information. So here's the fundamental question. Are Canadians grown up enough to fully control their own data? And is there a limit on that? So perhaps since Pamela, you arrived the earliest, and I'm hoping are the most rested, would you care to start us off?
Sure. So, Abigail, you asked that in a loaded way because are Canadians grown up enough pulls us right into the, is it paternalistic to even question whether people should have control of over their own data? And I think, there's really no perfectly popular side of this debate. So, as you know, I told you this was kind of a scary thing to be up here talking about. But I think we have to just be really thoughtful because on the one hand, absolutely, control over our own data is the core of privacy, and we all, I think, understand today, if not a long time ago, that privacy is fundamental to our freedom and to democracy and to so many of the things that we value. So yes, absolutely, there should be control by individuals, but we also recognize that at times people can make imprudent decisions and without necessarily knowing what the implications are of those decisions. So on the one hand, absolutely, I think we should be moving in the direction of putting it into the hands of consumers, but I think we have to be really thoughtful about how and under what circumstances and with what regime. And there's been so much talk about trust, and I know we'll probably talk about that a little bit more later, but I think we have to really think about the paradigm that we're releasing this data into. so that we don't end up in a situation that we don't want to be in, which is where something goes terribly wrong, and all of that trust and all of that promise of what we could do with data is lost because we made the wrong call and something went wrong with consumer control over data.
So if we're empowering Canadians with more control over their information, what does that mean for the role of the healthcare system and for custodians who have traditionally been in that protector role? Michael, you're unique in this panel in that you've been most recently an ADM of health policy on the government side. So you're in a unique position to comment on this, I think.
Right. So thanks, Abigail. Certainly, I've been in the role of commissioner now for 3 months, but before that, I was Assistant Deputy Minister of Health with responsibilities not only for the information management side, under which I had responsibilities related to our Personal Health Information Act, but also responsibilities related to research, responsibilities related to medical services, and responsibilities related to policy. So there were parts of me on any given day that were very interested in what can we and what can the residents of the province use this data for, but really my strongest regulatory role was that custodianship role that I had to advise the minister on his responsibilities for custodianship, and sat on the board of Newfoundland Labrador Centre for Health Information, which itself was the custodian of our electronic, it still is the custodian of our electronic health record. So in that regard, protection was our primary focus. We were very interested in Newfoundland Labrador to enhance access, and we're pursuing PHR and also access for secondary purposes, but protection of that data was our primary and guiding concern. And so I really struggled even then with the principle of how do you balance access and protection, and how does a custodian walk that line? And how does that change over time? Because I think these are very fluid times. This almost ambivalence has only been accentuated since I've taken on the role of commissioner, where access is now even more important to my role and my mandate as an advocate for access. I think some of the things that I try to remind myself of are, first of all, that when we talk about are Canadians ready, there is no one Canadian with a consistent level of trust that they have in their healthcare system. Some Canadians are very untrustworthy of the state and the holders of their medical information, and they need a lot more in the way of assurances about consent and about who holds their data. Others are much more trustworthy. Some Canadians have a great deal of capacity in terms of their ability to understand their data when they get to it, or even understand some of the questions that are related to consent, while other Canadians not so much. And yet still some of them care more than others. So who do we govern for here? And how do custodians and regulators govern for one Canadian when in fact there are many, many different Canadians? And we need to make sure that our healthcare system and the data that undergirds it works for all of us as a universal healthcare system. Another thing that I'll just throw this out there is I think that we have only begun to think about these issues. And I think that even the most highly educated Canadians with the greatest capacity demonstrate sometimes a certain level of cognitive dissonance when it comes to fundamental questions about the use of their data. We don't even know what we don't know as Canadians about our health data. Who has it? Where is it? Who's interested in using it for what? Under what servers are it served on, and what laws are enforceable upon that? We don't even know what questions to start asking. It is so early in this conversation about health data that, and I think, I'd be interested in probing more on some of these issues, but I'd just finish by saying that in this context, the last principle I want to put on the table is, I think, the precautionary principle in moving forward really needs to inform us in that environment.
So we've talked a lot about trust, and you've talked about that kind of cognitive dissonance, that an individual thinking one way, but their behavior pointing in a different direction. When I was looking at the Karen Alliance, some of the stats put up there, it reminded me of some data that Canada Health Infoway had generated. And it's one that continues to stick in my mind because we asked the question, basically, who do you trust? We asked Canadians, who do you trust? And we specifically asked them about app developers, wearable commercial providers in that space. And it was only 30% of Canadians that said, yes, I trust those folks to keep my information safe and secure. But it's a lot more than 30% of us, regardless of what you might be thinking in a survey, who are providing access to our data to those kinds of individuals. So Michael, Commissioner McAvoy, I shouldn't have gotten so comfortable there. Maybe that's our solution. You've worked at that intersection of public expectation, commercial providers' need to do their work. What are your insights into this?
So the word control was one that you raised at the outset. Do people? Absolutely. I mean, just think of myself. I'd love to go online now and look at my blood panels as soon as they, take 6 hours to do. I don't think there's any question that this is what the public wants. This is what patients want. This is what citizens want. On the technical end of things, if I can describe it as that way, bad things have happened, and we continue to get those calls in our office every day where there are breaches, some very sensitive data. These are things we work on with providers, and health authorities and others. Beyond the technical stuff, though, when we think about control, it's not only about patients having the ability to go online and access their information, it's about what else is happening with their data that they don't necessarily control, that is not transparent. And this is where I think we get into the trust issue in a significant way. Let me preface that by saying we as regulators are very encouraging of the innovations that are going on, of embracing the kinds of technologies that we have. It is some incredible things that can be done for citizens, patients, but it's only going to work. All of these plans, from e-prescribe it to whatever it is only going to work if there's underlying trust and confidence by the public. And Don Tapscott's definition this morning of trust, I thought, was very relevant to this discussion. So what does that mean concretely? We talk about the behind-the-scenes stuff. We talk about, do people have confidence or trust in it? Part of the problem is people often don't know what the hell is going on behind the scenes. They wouldn't know what to complain about. They don't know how their data is being used necessarily. Big story in the news the last couple of days about Google using people's health data in line with a company, I think, in St. Louis, Missouri. What's going to happen there? Can I bring it closer to home? On the back end to prescribe it? I think patients would want to know. It's great to have access, great to have the direct connections between physicians and the pharmacy and so forth. I'm just guessing, but boy, that's a lot of interesting data sitting behind the scenes. A lot of interesting metadata about who does what, about what frequency. Data that can be used for purposes that I think a commercial vendor would find very interesting and others might find interesting. Is there a conflict between that and what is in the interests of the patient? That's a really good question. What I do know is that if there is not transparency around how that data is going to be used for whatever it might be, analytics, potentially for the purpose of good, if there's not an understanding and a transparency around that, the system will not work. And that's really from the perspective of Michael's job and the job that we do, is we work with private providers, with health authorities in the public sphere and others to try and encourage that open dialogue with the public that I think will build trust that allow these systems to work.
Well, I'm grateful for the opportunity you just gave me, so I'll cheat a little and speak for Infoway's perspective on that. When I hear you speaking, I hear that to echo the pitch of the folks who were on the panel earlier this morning on the Prescribe It panel, talking about the importance of having an agnostic third party, a non-commercial third party to convene these systems and to exercise that control around the exploitation of data, as Infoway does with Prescribe It, to ensure that that information is only used for the purposes it was originally collected to facilitate that e-prescribing transaction. Michael, you?
Yeah, I mean, just to respond to that, I think it's very important that we be very long, we think long out on this. You know, and when we build our systems, I think we need to envision what secondary uses may become attractive, and not. I think that we will be short-sighted if we say, well, we're going to make sure that we build it in such a way that we cannot use it for those things, because you know, I just know, and also I know the way governments work, that if in 10 years' time we've built a gold mine and people come and say, we want to, we see immense commercial potential, all sorts of jobs, and not to mention excellent outcomes for healthcare, if you only let us at that data, in 10 years' time, are our governments going to say no? And going to say, no, we don't want those jobs, or we don't want that innovation in the health system. I think it's incumbent upon us now to always be looking out into the future and figuring out how are we going to say yes to those questions. Because it's the how we're going to say yes that's really important. Because we need to find safe ways for Canadians to say yes to those questions, in my view. And we need to start thinking about that now and building our systems for that now.
I know, Pamela, you want to get in this, but let's make sure we loop back to that point about how we mine the value of these assets in the interests of all Canadians. So, Pamela, you were saying?
Well, I was just going to respond that I'm not, I love that idea, and I think that you're bang on that we have to be thinking in the future, but I'm not sure that we could begin to anticipate what all the secondary uses of the data will be. Like, I don't think that 5 years ago, 10 years ago, we could have anticipated where we are now. So I think we have to build on the assumption that we won't be able to anticipate those uses, and then ask your how question. How can we build that way, and how can we build in a way that is still worthy of trust? And you know, we've talked a little bit about the cognitive dissonance, and we've talked about trust, and so I just wanted to point out that I think that there are differences. And so, you know, I've been talking about trust, and I love the fact that I think it's come up in just about every talk today. 4 years ago, it was put in my title. It was barely talked about, and I'm thrilled that it is such an accepted standard now, that this is what we have to be building to. But I also know that we can't just build to what will people trust.
Yeah.
We have to build to what is actually trustworthy, because people, we know, trust the untrustworthy at times. And we have seen this happen time and again. And as you say, we do, there is this cognitive dissonance. There is this sense that we don't all want to have to look. Like, it's great to be transparent and behind the scenes, but people don't want to have to look behind the scenes every time they do something with their data or go to see their physician. And so some will want to know, and it's important that they can know in order to have some trust in the system. But we have to figure out what are the standards that make something trustworthy and focus on that. So at times when, you know, I'm talking about TELUS, and someone will say, well, why should we just trust you because you tell us we should? And I would say you shouldn't, just because we say you should. The reality is most people do. That's the interesting thing. People just are trusting a lot of organizations with their data, and without inquiring into it. But I think my job and the job of industry and of government, and I think we have to acknowledge that these two things are coming together, and we're not just talking about healthcare data in the public sector coming out of the traditional healthcare system. We are talking about this convergence now, we have to figure out what is that kind of. We've heard trust framework today, we've heard trust protocol today. What is that paradigm, and how can we ensure that they are actually trustworthy and not just generating trust, because it's too easy to generate trust.
Can I take over your role just for a second?
I was just going to say.
Just to ask Pam this question. So it's true, we can't anticipate everything that may be used with somebody's data. And I've heard this even in law enforcement when we've done investigations. The police chief told us, well, we'll just keep all this information because you just never know when it might be used in the future for some purpose that we don't know. So the question, should we be collecting it in the first place and keeping it if we have no use for it now? We just don't know how it's going to be used in the future. Is that the kind of data exhaust we want to just keep piling on? And I say this in the context of work that I've recently done. Not that long ago, I was in the UK, and I ended up in the middle of helping to lead an investigation into what became Cambridge Analytica and Facebook. I would say, to the comment about trustworthiness, I'd say generally speaking, people are generally very trusting of significant corporate players in government. That was an incident, I think, that got a lot of people in the world, not just in the UK, thinking about how their data is used, what could go very wrong was sharing just a little bit too much on Facebook. What could go wrong with that? And I think people saw that. So I think the public attitude is shifting. So to my question, should we just keep, for whatever it's e-prescribe it or whatever the heck it is, we just keep collecting all that exhaust because one day, who knows, we may find a use for it that maybe good or bad.
So I hear a sense of urgency, and I find that as an organization charged with meeting objectives in a compressed time frame, I find that gratifying, because one of the things that keeps me up at night is the notion that we will ruminate on this issue when Canadians at the end of the day are not waiting for the health system or the government system to figure it out. So you've described the private sector players in this. You've got Apple Watch, which is a Class 2 medical device, actively collecting health information. So do you feel a sense of urgency the way I do, is my first question. And the other piece I've heard in this conversation is no debate about the need for citizen control, the importance of the consent paradigm in that, and the informed consent paradigm, and we've talked about some of the limitations of that. Are there other limits to how we can use consent in this context? And Michael?
So I'll pick up on a couple of those points, and I'll just the consent issue that you highlighted. One of the things I always like to remind myself is when it comes to personal health information, this is, and to your point, Michael, this is information that was, why are we collecting it all? So we are collecting, for the most part, in our public health system, we're collecting this data because we need it for patient care. And the context in which that data is collected is a context in which consent is often very, very highly complicated because in many instances it's being collected from patients when they're at their very most vulnerable. And the issues of why are they asking me this question for the 20th time today? Where is this data going to go? That's the last thing on their mind. They're sick. So I think it's really important. I think health data is very special in this regard because I don't think that we collect other forms of personal information within quite so heightened a context. So I think that makes it really special and important for us to really think about consent in a very different way and a special way.
I agree, but I also think that there are other differences with health data, and maybe to Michael's question earlier about should we be keeping this, I think there's just a sort of a clear mandate to keep health data for reasons beyond just the immediate care for that patient, and that is because we recognize that it can be used to cure other patients in the future. I mean, the research value is patently evident, and so there's always, the question that you asked, Michael, is highly relevant in a lot of other contexts, in a lot of commercial contexts. I think in health data world, it's a less important question, but still relevant, and maybe certainly in a personally identifiable form, that's a highly relevant question. But I think we also have to recognize that there are also some other limits with healthcare that comes out of the publicly funded system, and that is that this concept of, and we heard Don Tapscott this morning talking about ownership, and I always have a lot of trouble with the concept of ownership of data. I don't know that I agree that we should even think of it in that paradigm. I think it gets very complicated because data can be, if I own my own data, I can share it with this place and that place and this place and that place. It's now in all these different places. Are we going to get into some, legal construct of licensing? Like how can you own something and have others have it as well? I think it's kind of complicated, but I also think it's really a complicated thing, and I heard him say this morning, I own that scan, that medical scan that was done of me. I think that's hard to say in a publicly funded healthcare system, or even not a publicly funded healthcare system. Somebody developed the technology and took that scan. It didn't just emanate from your body. And so I think we have to be realistic about what the commercial incentives are to innovate around medical technology. We have to think about the fact that this whole medical system that generated all that information about your health, that helped to give you that medical advice, all of those reports, those all came from a publicly funded system. And so to say, well, I own that data and I can pull it out anytime I want, I'm not sure that's quite as clear a question as it would be in a different commercial context.
Yeah. So just to pick up on...
I was just going to say he is moderating the panel now. But
I think I would agree that in the health, particularly in the public space, I think it is a bit different when we think about the collection of the information. Abigail, you talked about consent, but the reality is that under our legislation, it's not uncommon across the country, is that there is an overriding thing built into our legislation, which data used for health research does not require, identifiably, does not require consent. I think the public is basically supportive of that.
Well,
But
I can
it's
comment very specifically on that, and forgive me for interrupting you. We've been working with a research team out of CAMH's Infoway because we very much are focused on not guessing about what Canadians want, particularly with respect to privacy, but asking them. Because I think we do make a lot of inferences about what the standard of privacy should be based on backroom conversation and not asking Canadians. And one of the things we heard, if you are empirical about this, is yes, Canadians do want to contribute to the system that is caring for them.
But there's a big but, and that is it's done within a context that they appreciate, understand, is transparent, is seen to be in the public interest.
Yes.
And so what we in British Columbia often talk about is having, where you've got all this incredible, rich data sets that can do a lot of work from everything from basic cancer to genomic stuff. If that's done in a safe, secure place with credentialed researchers, done in the public, done for the public good, I think the public is very supportive of that. Where questions get a little bit more challenging is where you start to have an interest, not surprisingly, by the private sector in wanting to tap that, as Mike would say, the gold mine that's sitting there. And that, I think, is, but my own view is, man, let's just take this one step at a time. Let's develop great research systems in the public sector.
So I just want to jump in on some hot pursuit there, because I was very interested to see your survey. I was lucky enough to attend a consultation session that you did. I don't know, it seems like it was yesterday, but the days have kind of blurred.
Last Thursday.
It was last Thursday.
The last day you weren't on a plane.
Right. So I agree. If you put it to Canadians like this, okay, we're going to help make you better. Your health system is going to help make you better. We've invested billions of dollars in this health system. It's going to make you better. Part of that quid pro quo is we're going to use the data that we get from that to help make other people better. Okay? And you put it really simply like that, I think that is something that would resonate with Canadians, right? And I think that supports the survey data that you showed us. So we've been having a debate in our province, it's simmering at a very low level, about the use of genomics data by private companies that are now interested, because Newfoundland and Labrador's, what we sometimes call genetic architecture, is very, very attractive for genomic research. And so now we're attracting academic research, and we're attracting commercial research as well. So let's say that we put the question to this same set of Canadians, and we're going to say, okay, we're going to help use this genomics, all this money that we've used, including to collect genomic data on you. It's going to help you make you better, or it might help you make it better, actually. And if you ever go and get genetic testing, they're going to say, well, actually, it probably will test you, but it probably is not going to tell you anything. But in the future, it might help someone get better. We're gonna do that for you. And part of the quid pro quo is that a private sector company might have access to that data to do some drug discovery and make some profit out of it. So on the one hand, that was, depending on how the story is framed, what we're seeing we've been surveying Newfoundlanders and Labradorians about this. On the one hand, many people react and say, that's great, that's lots of economic opportunities for Newfoundlanders and Labradorians, and there's jobs there, and we could become a hotbed of genetic research, and there could be drug discovery that comes out of it, and that'd be great. And then other people react by saying, wait a second, you've poured millions of dollars into public infrastructure, and you're saying that this company is going to come and derive profit out of it? I'm not comfortable with that. What do I get out of it? You're telling me I'm not going to get anything out of it? So what I think that we need to have a social license conversation, and about what forms of secondary use are resonating with Canadians. But I don't think that social license to do certain types of secondary use is something out there for us to find, as in Canadians have a concept of social license. I think it's something that we need to build together without a predetermined outcome of what that social is going to look like. I think it's something that we need to build all together through conversation over time. Now, the sense of urgency weighs upon me.
Yes.
when I hear that, because, things are moving very fast. So how do we, if I'm right, how do we do that fast enough?
Well, because if we talk about genetic information, it's interesting because as we talked about when we were preparing for this session, it really does break the paradigm of individual consent, because I'm no longer just consenting for myself, I'm consenting for my family, I'm consenting for my child, I'm consenting for others. So it's certainly stretching that paradigm. And it strikes me because if there's one piece of health information that is being broadly collected in a space completely untethered to the healthcare system that Canadians know, trust, want to reinforce, it's genetic information.
The ship sailed on that.
Yeah, exactly.
Well,
The ship has sailed,
I'm not
yes.
sure that we say the ship has sailed. I'm not sure that I agree with that at all in terms of having. I mean, I think of the incredible potential for the Mendelian randomness stuff, where you don't have to necessarily spend hundreds of millions of dollars on drug testing, and where you can get the samples just looking at tendencies in people's genes. It holds incredible promise. But Canadians have not been engaged in that discussion at all at any level. But I just come back to the point I earlier ended on. I think we just need to take these baby steps, one thing at a time. For those of you who have been involved in research at a provincial level in the public sphere, I think many people would agree that there are some significant challenges. Even people in the public sphere doing stuff for the public good, it's been a challenge getting data in order to do research. And so I think we need to go there first, get those systems in place, and then maybe talk about a conversation where the private sector might gain access to that, and on what terms that benefit, to ensure that we benefit the public.
So two things come to mind here. One is, with 20 minutes to go, privacy people can talk to privacy people, possibly to the ends of the earth, and I always worry that we've lost other people who don't find it equally as fascinating. And the second is, I've been looking at myself with the chin angle here, which I don't find attractive, so I'm going to face forward and encourage folks from the audience to ask some questions so I can enjoy, because I think this is a better angle for me. Deborah, excuse me.
Hi, thanks, Abigail. So I'm Devorah Richler. I work for Roche from St. John's, Newfoundland. Yes.
All right.
I'm really interested in everything that you talk about. This is my passion right now. And so I came up with a really good question, I think, for you. But first, I just want to say, coming from the private sector, I think you guys have to stop being so afraid of the private sector. We can actually help bring things to market. We can actually help make this a better healthcare system. That's why we joined Canada Health Infoway's Access Alliance 2022. That's why we're super excited to be here. There is a quid pro quo for patients. You can tie it using blockchain. You can tie it back to those patients, and they can receive return on investment from whatever data they've given. There's a way to do this, so don't be so afraid of the private sector. My question is, we've talked a lot about trust and trustworthiness and making sure the public understands who they can trust and how they can trust. I would ask you, do you think we've talked enough about how you as government bodies are holding people accountable for data stewardship? I would push back a little and say that if an average Joe went to read the newspaper to find out what happened if their data was breached, they wouldn't be able to find it. So if you're trying to create trust and you want people to really believe in how data is going to be used for the greater public good, we need to hold the people accountable if they're not doing that, and we need to put it on the front page of the Globe and Mail and show that we're doing something about it. And if you can do that, you will build trust. So I would just like to hear your thoughts on that.
Yeah.
So do you mind if we start with Pamela? Because one of the pieces you raised, Devorah, which I think echoes a sentiment in a conversation we've had from time to time about the importance of this as an economic driver conversation. How do we incentivize the innovations that will help Canadians? And I think there's a link to what Devorah was raising there, and then perhaps we can move to the gentleman around the policy issue.
You wanted that front angle to the audience a little too soon, because I wanted to respond to it. But Michael did. But Michael said, so thank you for that, because I 100% agree, and I appreciate the caution, and I think, I'm the first to say we have to be cautious when we talk about people's privacy, and in particular, possibly in the healthcare sector, although I'm not sure I see the same distinction. Not because I don't value health data, but because I think I value other data potentially more than maybe is typical. But I think this idea of saying, well, we're just going to stay in the public sector and take baby steps before we, then open it up to the private sector. The private sector is racing along. The public sector is struggling to manage this, and we need to be working together to do this properly. That the technology and the innovation to actually unlock the potential that's in data is mainly coming from the private sector. And there's lots happening in academia, but again, often and most often in partnerships with the private sector. So to say, the public sector can be trusted in the private sector, we gotta deal with them later when we figure this all out. I just don't think that's realistic, and we will have lost the moment because the private sector will have stepped in and taken the space because the population is ready to share their data. They are ready to participate in their own their own health outcomes, and if we don't figure out how to do this together, then the private sector will do it alone. So let's figure out how to do this together and generate that trust, and whether it's through open regulation or other mechanisms, but I think we have to have that discussion. I 100% think this is urgent. I'm quite fearful that we will miss the opportunity to leverage the type of data that we have if we don't start talking in more earnest about this and doing something about it. So to me, the call to action is, every organization and every government institution has to be focused on making sure they get this right every single day, because we can't take many more Facebook, Cambridge Analytica scandals, because it will destroy the public trust in data. And I think I was saying one time when we were talking, Abigail, that I have 3 teenage children, so I won't disclose which one. But at one point, one of them said to me, "Mom, can I be okay telling my doctor, the doctor always asks me if I smoke marijuana. It's legal now here. If I say yes, is that a mistake? Is that going to go in an electronic medical record? And do I have to worry that someday, for whatever reason, because of political change, that will cost me a job or make it so I can't cross the border? Can I be sure about that?" And I want a world to come now where I could say with 100% confidence to that child, yes, you can be sure about that. Yes, you need to be able to tell your healthcare provider the absolute truth, and you can trust that digital ecosystem. I don't know that we're quite there yet. I think we need more players thinking hard about this. I think we need to make sure that we have that partnership, because otherwise we will have untrustworthy players in the space. And to me, this is absolutely urgent, because I was kind of really struck by that question and my inability to give the answer I wanted.
Commissioner Harvey?
Yeah, so just to respond to the question, I wouldn't want to leave the impression that I'm afraid, or that I think our regulators are afraid of the private sector. I think the notion of private sector and public sector seen in that way is a bit of a false dichotomy. I mean, I certainly know from the operational side of it that the public sector does not deliver the healthcare system without the private sector. Our EMR, we have a single vendor EMR in Newfoundland and Labrador. It's a TELUS EMR. We're interested in proceeding with Prescribe It. It's a TELUS application. The private sector went through, yes. But the issue is the private sector is absolutely there. It is how we together fulfill our mandate. That's not the issue. I don't. So there's no sense really of fear there. It's a sense of preparedness. So if there's another dichotomy, it's between the secondary use of personal health information for let's say public, that clinical care, academic research, decision support, versus the other side of that dichotomy will be for commercialization. And what would that look like? Again, I think there's falseness to that dichotomy as well. But again, I don't think I agree with you. I don't think we should be afraid of that conversation either. In fact, to my earlier point, I think we need to envision what that conversation is going to be, because it's going to be upon us. In fact, I'd argue it is upon us. And so therefore we need to, we can't pretend it's not upon us. So we need to be ready for that. But again, I think we still need to employ the precautionary principle in the selection of our use cases. Yep. So we need to, I think, take a risk-based approach, be visionary, but take baby steps nonetheless towards that long-term vision. So we need, I think, in any given room when we're thinking about this, we need to have the opportunists who are figuring out what's feasible right now. We need to have the visionaries who are thinking, where are we going to be in 5 years' time? And then we need to be putting that together to figure out a path that takes a risk-based approach to how we get there.
Well, and I think we've heard on the panel two very healthy perspectives on risk here that I think are complementary. One is the risk that we bear if we don't take action, we don't begin to progress, start taking steps. We can debate the length of those steps and the importance of taking a managed approach. Would you be deeply hurt if I move to another question?
No, there was just one little strand in that question, though, that I just... Yes, I would.
Yes.
To answer your question. There's one little strand of that question that I just wanted to just illuminate on. So there's a part about the public sector and whether it's handling data properly, and as you as government people, what are you doing about it? Just to be clear about the role that Michael's office plays and my office play, we are independent officers of the legislature. That means we oversee what government does. We oversee actually what the private sector does independently. We are not the arm of the Executive Council of Government. We are appointed by the entire legislature, which gives us the responsibility to make sure that public bodies are properly protecting information, so that if there is a breach, and we get many of them, that we're working with the public sector to make sure that those are being dealt with and the public interest is being protected. And when we talk about privacy, that term used shorthanded, really it means many things, but in this case it's really about the protection of people's information, to ensure people would want their information to be protected by people of integrity on the other side, to use Don Tapscott's words, and we're there to ensure that that happens.
Perhaps we could go counterclockwise, clockwise?
Hi. I have a really interesting question, simply because everybody seems to be tap dancing around, the subtleties of information, and what if we were to reclassify the whole idea of consent? I am a patient. I want certain basic information accessible to my health information custodian in my circle of care. However, I would also like my health information available to research. Now, I have met certain patients that do not want their personal information accessible to research. So what if we were to subcategorize the whole concept of consent and the audit trailing of this consent that can change over time, and thereby either allow or disallow my health information and circle of care access, my researchers, again, access or no access, and then finally, the almighty dollar, do I want to sell or not sell? Can you comment on this, please?
Do you mind if we start on the third? Because I feel like our legislation is pretty well defined around, as you mentioned, Michael, use within the context of the circle of care, use for research, but you're raising the commercial, to sell or not to sell. We didn't spend a lot of time on it, but Commissioner Harvey and Pam, you both raised questions about whether that is a relevant, whether that's the right paradigm to consider in this context. I should stop the sentence there.
And I agreed with Commissioner Harvey. I'm not sure that it is a perfect paradigm to say, well, the commercialization, and I hate it when people talk about, well, there's social good and then there's monetization of data, as if those two things are perfectly distinct. And I don't think that they are at all. Even in the most straight monetization of just, businesses doing better, that actually has some social good. It creates a better tax base and a healthier economy. So, but that aside, I think especially in the healthcare industry, the concept of when data is commercialized and when there is profit making in the healthcare industry is not a clean one. And there's profit making all over the healthcare industry, throughout the healthcare industry, and always has been pre the data revolution. So I'm not sure it's that simple to be able to say I want it, sold or not sold, or used for commercial purposes or not, or monetized or not, because we can. So used for research, for finding out if there are better drugs. Is that sold? Is that for research? Is that, there's commercial profit there. There's also social benefit there. So I think we need something more robust to look at weighing social benefit, individual cost. What are the ways that we can look at the entire data ethics of the decisions that we're making? which is a broad world, and that takes us into, you know, what's been talked about in the industry for a long time now, like broader data governance discussions around data ethics and what is an appropriate way to use data. So I think it's a great question, because I think we have to think about all the different scopes of how data gets used. I just don't think it could be that quite that black and white about the consent piece, but we do need those data governance models.
Absolutely, and I'm conscious of time because Commissioner Harvey, you used the expression soil, not oil, with respect to data, but I feel like that's more than a 6-minute item.
It is, but I've been thinking about how I would get to that idea and a couple of others in ways that won't eat up all of that. So I think it's a very interesting question. I think that the seeds of its answer are in the question that we do need to move to a new paradigm of consent, one that is no longer static and all or nothing, a point in time where, yes, I consent to this use of this data for all purposes, for all time, here you go, goodbye, you get your health services, don't come back, to one that is evolving over time, is multifaceted, and indeed has much more control over those multifacets and over time for Canadians. And I think that this is the difference between oil, which is used once. So data, I don't believe that data is the new oil. Oil is used once, it burns, and then it goes up into the air and causes trouble for all of us. Soil, however, is grown in, and I think consistent with that metaphor is personal health data that can grow, and hopefully Canadians' relationship with it, in this ongoing relationship with their personal health data, can grow with it. I think we've often, again, in my old role, we've often talked about how Canadians need to be more accountable for their own health. Yep. And I think that an evolving notion of consent and a greater maturity in how we interact with our own health as Canadians and our own healthcare system is key to that, and evolving consent is, I think, part of it. So that was a minute and a half. 6 minutes.
That was not bad, and I'm going to be cheeky and take 30 seconds of it to say, because anytime I hear someone talking about consent, not as a paper to be signed or a question asked once, but rather a relationship, a dynamic relationship, I think it bears a moment to pause on that, because as we talk about and plan for the access gateway, facilitating that ongoing dialogue from a technology perspective is core to building that service out. So you've been a very patient woman, Susan.
Now, understand, I'm coming from a point, I'm here representing the vendor community. So please understand my question in that context. I helped to write the data breach regulation that Alberta passed, specifically in terms of expanding penalties for deliberate data breach. I hear trust. I hear about comments, oh yeah, we should put something on the Globe and Mail. But I guess my question for discussion is, if the penalties were severe enough that it would discourage deliberate breach of trust by vendor communities or even researchers for that matter, would that help to accelerate the rate of trust to enable some of the things that we're talking about today? So it's not just talking about trust, it's talking about the consequence of distrust.
I think the answer to your question is yes. In British Columbia, we do not have mandatory breach reporting rules, which I've urged that the legislature take up, because I believe that will give the public greater trust. I think this is an evolving area where there is a greater appreciation by more people about the critical nature of these kinds of breaches. They're often called snooping cases. I actually find that trivializes the problem. It is an abuse of people's authority. It's an abuse of information that they have. It still is surprising in this day and age, despite the fact people know they get fired for these things. Now you layer in Alberta on top of it. You've got penal consequences potentially that may come, offense charges that could come as a result. But I think that heightens in people's minds with the penalties. I do think that makes people think twice about abusing that privilege, that trust that they have over data. And I think that will help to reduce the problem But still, I have to say, I don't know how many of you found this experience, you just shake your head when you see what people will do snooping on former spouses, as the term goes, and all kinds of things.
In this business, it's the interesting stories. So Pamela, if you want to take 30 seconds, and then what I'm going to ask the panelists to do is give us the 30-second so what.
So I was just going to take a quick contrarian view, because I think we're supposed to be creating a little kerfuffle on the panel. But, I think on the one hand, fines can, and certainly speaking as someone who, rents a privacy office, it's helpful sometimes, honestly, to be able to say, well, there are fines, because for some companies, that will get you the attention of, your CEO, your senior executives that you might not otherwise get the attention of. So there's some truth to that for organizations that don't have some other skin in the game, like a reputation, et cetera.
Exactly.
For us, reputation governs way above any fines. Like for us it's about what our customers are going to think of us. But that's not true for all organizations, and I recognize that. But that said, when you talk about really substantial fines and you start to go to the GDPR world, I actually think that what we saw was the reverse happen. That when I joined TELUS and we started talking about customer trust rather than privacy compliance, we saw our ability to make things happen go skyrocketing.
Yes.
Because if I go and I talk to a business unit about privacy compliance, they will do the minimum possible to get all the checks in the box to make Pam happy and be done with it. But when I talk to them about customer trust, this is about putting our customers first. They value their privacy. They will not trust us if we don't do this. Then the business got that. That's the language they speak. They value customer trust. They would do everything I suggested and more, and they would think about it that way forevermore. And that made a huge difference to the actual rigor of the privacy program. But what I saw was organizations that had maybe taken some of those steps towards being more trust-based, and then all of a sudden it's like 4% of your global turnover, your global revenue is on the line. Oh my gosh, what do we need to do? And suddenly the checklist came out, like make sure they can't get us on this, make sure they can't get us on that, make sure they can't get us on this. And massive amounts of money were spent bringing organizations with relatively mature privacy programs into compliance with the GDPR, suddenly talking all about compliance again instead of about trust. And I don't think in a lot of those organizations, actual privacy protections were increased one bit. They just developed a program that had different pieces of paper and different check boxes and spent millions of dollars doing that to be able to demonstrate those check boxes. But I don't know that they actually substantially improved privacy in those organizations. In some cases, certainly that would have been the case. But I think that the extent of the fines drove people back into this, oh my God, compliance mentality. So I think we have to be really thoughtful about where we're going with that fines can serve a certain purpose, but they can also put us in the wrong direction.
So we're standing in the way of more sugar and more caffeine, which is a dangerous place to be. So before we move to a break, I'm first going to say thank you, but we're not off the hook just yet. So thank you for traveling very far distances to participating in this vigorous conversation, not saying perhaps the things people expect you to say, but the things that we need to start hearing and dialogue on. So thank you. And second, 30 seconds or less, what's the call to action here? We're going to leave this room. I've heard urgency, that there is in fact a time clock here. I've heard that Canadians do have a right to own and direct and control their information. We need to think differently about it. And I've also heard that changes of law take time, and there's action we should be taking now. So what is that action?
Okay, so I think you pointed at me, so I'm going to go. I think we need to do 4 things. The first, I think we need to educate. I think we need to let Canadians know what we know about their personal health information. That's a very one-way focus, but that's only one of the things I think we should do. I think Canadians do need to know more, so I think there's an education role. I think there's an engagement role, as I just want to echo the things that I've been trying to hammer on. I think that we need to have a conversation with Canadians. I think social license needs to be built, and I think we need to do it together. I think that there's roles for all players, governments, regulators and oversight bodies, the private sector, academia. I think there's a role for all of those. The third, I think we need to innovate to keep up. I won't go further into that. I think there's a room full of innovators. And the last thing is I do think that we need to legislate. I think there are improvements that we need to make into our statutory and our regulatory regime to address, I think, the fine question. It's a very interesting response. I think the fine question is an absolutely legitimate one. I think I think our statutes need to be more sophisticated now. They think about consent and other things. I won't go further into that now, but those are the 4 things. Educate, engage, innovate, and legislate.
Not bad without any sleep. Pam?
Well, while we're waiting for the legislation, which we've been waiting for a really long time, I think we have to the private sector has to act now. And I believe the private sector and the public sector have to work together, particularly in the healthcare world. I think that we have to all recognize, if we are players in the healthcare space, that trust is absolutely paramount. And so what can we do to build that framework that would actually make something trustworthy and then be able to communicate that and make it transparent? And so there's been a lot of work. I liked what I saw about Karen. There are similar projects that are going on in Canada right now, a lot of work about how can we build that data ethics framework, that governance program, so that we can make those decisions down the road that we can't actually anticipate today having to make, and start working together more, so we're not all just working in little silos saying, well, my privacy program is better than your privacy program, so that we can actually have something that works together.
An Infoway session tomorrow on the agenda to talk further about how Infoway thinks we can contribute to driving out that trust framework in health. Commissioner McAvoy.
Let me just end on a congenial note by saying how much I agree with what Pam has just said. I think all of us in this room are in this together. We're at a critical intersection in all of the issues we're talking about today. And if we don't get it right, nobody should take anything for granted, or the inevitability that everything's going to move in one glorious curve as we work private and public sector together to create all these solutions for citizens and patients and individuals. We've got to make sure that we have an underlying framework. Come back to that T word again, but it's absolutely critical, and we all share in that responsibility, whether we're the regulator or the private or the public sector, trying to do our best to make sure that that's maintained. So,
not a bad final note. Nice. So with that, I invite you to grab a coffee, refresh, sugar up, because we'll be back in a few minutes after the break. So thank you very much.